everyone. This is not just an interview or review that I'm posting it over here. This is my experience that I've come across and after the surgery, and you can see before and after photographs and how the transformation has come. And I really uh, I feel happy because this is a 35 years long difficulty of my breathing. Now I feel a bit comfortable after surgery, but it still take time of a few months to go because inside there are some post-surgical scars are available and swelling, but that will subside after some time. But hopefully, uh, I feel best, and I would suggest everyone if you wanted to make change in your life or you have any difficulty, please do visit Dr. Sunil Richardson's Face Hospital. Thank you.
9 years ago.
Yes, in 2015. It was done minimally. I think they chiseled out the
Okay.
out of it, but still I have that difficulty.
Exactly. So what we have to do is redo septo-rhinoplasty. Septoplasty, because what they've done is not done completely, so it kind of do a redo or remove that bone that's bent and not removed. Then you have to do a rhinoplasty to give you shape to that nose. This is punched in, we can make the nose a little bit more bigger. It's too small for your face. So we might also have to harvest the rib. So it's going to be septo-rhino, septal reconstruction with rib.
At the alar base is very broad and has got a very thick skin, the flat dorsum and radix. We are planning to do a septo-rhinoplasty using a rib cartilage, going to give the tip support using a septal extension and tip graft, and also do work on the dorsum and radix, kill the tip to give him a good projection, increasing the length as well as the projection of the nose. We're planning to reduce the alar base width by doing bilateral alarplasty. All of this will be done in one go. We're under general anesthesia. Now we'll be shifting the patient to the operation theater. Thank you.
Just done with this male redo cosmetic nose job. That's how he was before. So you can see that nose was way too short and small for his nose. He also had breathing issues, history of septoplasty done elsewhere several years ago, some deviation that has been corrected, open structure rhinoplasty, work around the tip, very thick skin. It's really challenging to get that skin to mold and to refine the tip. I'm going to show you another view of his.
So it was third day for him after his cosmetic septo-rhinoplasty. Minimum swelling is having. He'll remove the nasal pack on 5th after for 2 days, that is on Monday. Otherwise he's doing well. Okay, right. Able to eat well, right? No brushing and eating, no issues. So remove it on Monday morning. So then you'll see much better after that. Okay?
Well, everything is good. Superb. Carry on. Normal diet you can take. Whatever you want. Alright? Good evening.
She's my daughter. She's come along with.
Hi man. Come here or sit there wherever you want to sit. You're most welcome to that. Little bit only when we take out the. Yours was a redo, right?
Yes.
Good. He's looking very nice. You give him the mirror. You can see the huge improvement. Let's have a look. Okay?
Yes, sir. Yes, it's so good.
Yeah. The whole face has got tighter, younger. Nose looks more manly,
Yes.
proportional.
Yes. And how about the swelling inside?
It'll go down slowly. You're not having that much of swelling actually. There's this swelling a little bit here and this area, but this is all because of the surgery. You know, it was very loose. You've tightened it up.
Okay.
That won't become like this ever. It will look like
Sure, it looks better.
yeah, looks very nice. Take good care of your nose. See the side view also. You can see how much difference.
Yes.
So when your last surgery was done, this would collapse the tip. So then I've reconstructed the tip, septal reconstruction, augmentation of the radix and everything. Look, that's it. Please one more. So this area, it will come down, huh?
Yes.
So that was looking straight. It will come down, but not such a huge dip, but a gentle dip around that part. Okay.
Yes. Happy to see this.
You're most welcome.
Thank you so much.
You're most welcome. Take care and stay in touch with us.
Sure.
So what you can do is we give you a follow-up number. See what happens. I'm always happy to hear from your patients after a month, after a year, after 3 years. I don't know, whenever. If you're happy to come this side, just visit if you can.
Sure.
Otherwise, just drop a message how you're doing or any concerns. Definitely.
Sure. Thank you so much. It's my. I don't have words to express. So this was a 35 years of struggle. So when I fell down my school, so that's when the septum was deviated and it was just like going. This was growing and I had this breathing difficulty so long time, and that was once it was done in 2015. That the procedure was not correct. So now I can see the difference, the facial difference of the constrictions, and the only thing is if I can able to breathe completely, I would.
Pleasure.
Thank you so much, sir. Can we read?
Yeah.
Thank you so much.
Bye. Bye.
Thank you.